Welcome to Beacon Health Diagnostics at Daniel Jones branch. I was at this branch some days ago to carry out my annual routine checks. Beacon Health Diagnostics has 14 branches all over Nigeria. It took me almost 3 hours to carry out 12 tests. It was a seamless experience, except for the pap smear. Oh my God, it was not a nice experience for me. I will share my experience with you in the next video. In the next few minutes, let's listen to an interview with the Beacon Health team. My name is Musumola Dosumo. I'm the founder of Menopause Support Initiative, and I'm so glad being here this morning. I've been wanting to do this forever. What do you have to say about the partnership between Menopause Support Initiative and Beacon Health?
Okay. Personally, I believe it's a welcome development.
Thank you.
Especially since in the country we are dealing more of reactive healthcare instead of proactive. And so this initiative, which helps to foster preventive healthcare, is a big one. Nigerians ordinarily, we don't like going to check for our health status and knowing what is actually up or what is not up there in our health system. But with this initiative and with the kind of publicity that is being given to it and the necessary requirement for people that are getting to the age bracket to take this offer is quite tremendous.
One word I have been able to pick is preventive health care.
Yeah.
We don't have to wait till our health goes down and then we start running around. We start raising funds for who is going to support us. Now the program is kicking off. What can you say about the series of tests and the benefit to our members? Our members are from the ages of 38 and above.
Has mentioned, the fact that it is very important that people know that it is better to prevent, these diseases and ailments rather than, having to work on curing. I remember there was an incident, giving an example. I like to give real life scenario. I still had a conversation with one of our partner doctors a few days ago of a staff that died of cancer, and this is because she must have, had the signs, probably put it aside. So it is very important that we understand, especially in this part of the world, that, we need to take our screenings, our medical checks very, very important, especially when we are getting to the age where, from the age of 38, 39 upwards. I, for example, I already have my children. The system is not like before. There are hormonal changes that can trigger anything in the body. So it is very important that, women, men check every 6 months, every year, what is happening in the body exactly. I know that on the list of investigations that we had agreed on, we have the pap smear there. What is the essence of the pap smear? It's to check if there are, well, I'm not a medical person, but being in the healthcare field, is to check if there are traces of cancerous, cervical cancerous cells. If you are able to detect early, it is easier, to quickly treat or prevent cervical cancer. Same with men. If they are able to do their PSA on time, they are able to prevent rather than having to then go ahead to start doing the colonoscopy. It is very important that women, men, do their screenings as and when they are supposed to. Another test is the ECG, right? I know ECG is on that list. We have the ECG. Mr. Kevin, the ECG test, I know it will help to check, the status of the heart. Is the heart beating properly? It's as simple as that. If you're able to check why, if there's a reason to, if the heart isn't beating properly, why? So you can quickly, the doctor can quickly, you can quickly be referred to see, a specialist, a cardiologist. So why is the heart not beating properly? It could be as simple as the sugar level, and once the doctor detects that the sugar level is high, and you work on it, then
Stabilizes.
it stabilizes. So sometimes people are scared, to go for their annual screenings. They're like, it's better not to know.
I used to be like that.
Yeah.
It's better for me just not to know.
Not to know.
I remember when my body system started changing at 42, and I had depression and brain fog. And I thought to myself, my children said, "No, mom, you have to go to the hospital." I said, "I don't even want to go there. I don't want the doctors to tell me what is not." But God helped me through that stage. And right now I'm here. You see, once the hormones are changing, it affects every part of the body.
Of the body, yes.
So the earlier, the better we'll check this to be proactive than being reactive.
Yeah.
So I encourage every Nigerian out there. You've been finding it very difficult, or you procrastinating. Should I do it or should I not do it? This is a time for you to join the Menu Club and be a member. You don't even need to be a member. You can just come, join us for the preventive package, and continue to stay healthy.
Right.
It was a good experience. Your staffs are very, very warm and friendly,
Thank you very much.
except for the pap smear. But it's just a necessity for me.
Yeah.
Now I've done the test. How soon will I get it?
Okay, so for the ladies, because of the pap smear, which usually takes a timeline of minimum of 72 hours for the results to be available. So we're looking at 4 days, so maximum 1 week.
1 week.
7 days you get your results fully reviewed by the doctor.
Oh, the doctor will, within that 1 week,
Within that 1
will be fully
the doctor will
reviewed.
go, okay, so this is how the doctor review comes into play.
Okay.
So all the tests that have been carried out, including the physical examination. So during the process of physical examination, questions will be asked if you have any concerns or pains or the like that you are feeling at any region of your body that you want to share. So those information that are taken into consideration while the physical examination is being done. That is the normal process for physical examination. So while they are doing all that, all these information are being jotted down. So in the process of doing the 2 full reports, every information provided and the test carried out is going to be recorded on the report sheet. So it is this information and the test results that the doctor will use to do a review.
So I don't need to be present physically for the review?
You don't need to be present physically to see the doctor. Now, because most of the information that needs to be gotten have been provided by you and by the test that was carried out, the results. Understand? So it is with these results and the information that we will then say, okay, let's say consultant and the doctor, in-house doctor, do a review, thorough review of everything.
That's beautiful.
After they've reviewed everything, then they can then give recommendations based on their observations from the
so you send the results to my email?
Email or...
We also have to agree that
Those are done by your consultant. Do you charge us extra cost?
no. So by default, once you come in to do your screening, you get your results reviewed by our doctors. There's no additional cost.
There's no additional cost
to it. No additional cost.
Okay.
Yes.
So we're getting value
for
our money.
Yes, exactly.
Thank you very much.
You're welcome.
Thank you. Those who attend the Vals and Gout will attract 5% discount on any of the packages of their choice. Make it today, February 14. Let's have fun.
Things beautiful. You make all things beautiful.